Here are a few case studies illustrating the application of pharmacogenomics in gastroenterology and hepatology. A case report published in Clinical Gastroenterology and Hepatology in 2019 described a patient with inflammatory bowel disease, or IBD, who experienced severe myelosuppression following treatment with thiopurine medications, specifically azathioprine. Pharmacogenomic testing was performed to identify genetic variations in the thiopurine methyltransferase, or TPMT gene. The patient was found to have a TPMT variant associated with the reduced enzyme activity. Based on the test results, the patient's thiopurine dose was adjusted to prevent further myelosuppression, resulting in improved tolerability and treatment response. In a case study published in Digestive Diseases and Sciences in 2014, a patient with Crohn's disease underwent pharmacogenomic testing to guide the selection of anti-tumor necrosis factor, or TNF, therapy. The patient had previously failed multiple anti-TNF medications. Genetic testing was performed to identify variations in the NODU CARD15 gene associated with Crohn's disease susceptibility and response to anti-TNF therapy. The results indicated the presence of a variant associated with a reduced likelihood of responding to anti-TNF therapy. Based on the test results, the patient was switched to a different medication with a different mechanism of action, resulting in significant improvement in symptoms and disease remission. A case report published in the Journal of Clinical Gastroenterology in 2016 highlighted the role of pharmacogenomics in optimizing proton pump inhibitor therapy for gastroesophageal reflux disease. The patient experienced suboptimal response to standard PPI dosing. Pharmacogenomic testing was performed to assess variations in the CYP2C19 gene, which is involved in PPI metabolism. The patient was found to be a poor metabolizer due to a specific CYP2C19 variant, resulting in reduced drug efficacy. Adjustments were made to the PPI dosage based on the test results, leading to improved symptom control and resolution of GERD-related complications. These case studies demonstrate how pharmacogenomic testing can guide medication selection, dosing adjustments, and treatment response in gastroenterology and hepatology. By considering an individual's genetic variations, clinicians can personalize treatment strategies, enhance medication efficacy, and minimize the risk of adverse events. However, it's important to note that these case studies represent specific scenarios, and pharmacogenomic testing recommendations may vary based on individual patient characteristics, clinical guidelines, and available testing resources.